Like you mentioned, you kind of conceived of the union as a third party, but the union only derived the ability to save you from being fired because you were a member.
Which side are you on? Which side are you on?
We've got a listener voicemail. Adam, can you play the voicemail for us?
Hey guys, this is Jack calling from Georgia. I just wanted to say I really love the show, and I especially love the episode you did about organizing and sort of looking at it from a union being a third party versus being part of the union. When I last lived in the UK, which is about 10 years ago, I was part of the Communication Workers Union working for British Telecom. And, I enjoyed being in the union. They helped me a lot. I almost got fired a couple of times, and the union helped me. But I definitely had that feeling where I felt like the union was sort of this third party thing. I mean, I never thought about it except for in relation to maybe a specific time when I needed them. But in my day-to-day, I didn't know anyone who was in leadership in the union. So that's definitely something that I'm thinking about now. And secondly, I just wanted to ask, I'm an ultrasound tech, obviously not unionized here in Georgia, but have you guys done any episodes about union organizing within healthcare, specifically within ultrasound? Thanks a lot. Take care. Bye.
Thank you, Jack from Georgia, by way of the UK. We appreciate you listening to the show, and it is a very important thing to point out that the union is the workers, even whether or not the workers realize it. Like you mentioned, you kind of conceived of the union as a third party, but the union only derived the ability to save you from being fired because you were a member. And because your coworkers are a member. So it is important that unions foster that understanding among their members that unions are the workers.
And we've been clear on the show that at times some unions and some leaderships of some unions foster the third party kind of angle and, have sometimes it's what they think is the practical thing to do. To maintain membership. Sometimes it's out of self-interest and to kind of preserve their own power and to be a big fish in a small pond, right?
Yeah.
Because the more democratic your union, the more people are engaged, the more people know what they're voting on when your name rolls along on the ballot. So, those are legitimate issues inside of our own movement. But I do think that you've touched on something, which is that I think the default position for a lot of folks who join a union is to see it as a service or to see it as another organization. They belong to it, but I'll call you when I need you kind of thing.
Right.
So I think having the constant engagement and getting new people involved and taking it upon yourself, even if you're just a rank and file member, you don't have to hold a position or run for office to do things, to do union things, to, grab 2 or 3 coworkers and have a drink after work or have some coffee after work, before work, and start talking and come up with ideas. Yeah.
And as for have we ever done anything on organizing in the healthcare industry? Yes, we have. One of the first interviews that we did, actually, and so the audio, and I don't know why the audio was so much worse in the radio station as opposed to at Spice Radio, because that's a professional, they were actually literally the same microphones in the radio, but so I don't know what the deal is there, but the audio is not quite as good. But some of the first interviews that we did were with union nurses from Pennsylvania. And those are going to be linked in the show notes. But the first one was with 2 nurses from Pennsylvania. All the nurses were members of PASNAP, the Pennsylvania Association of Staff Nurses and Allied Professions. The first interview was with Bill and Joe. One of them was conservative and the other was ultra liberal. is what he called himself, and they talked about how, like, despite their political differences, the union has been very important for them and has even allowed them to respect each other as individuals. They talked about their fight against the big mega corporation that bought their community hospital and tried to institute staff cuts and resource cuts and stuff like that. And we also talked to Carla LeCoyne. She was another Pennsylvania nurse, and she talked about. So we talked to Bill and Joe while they were, I believe, they had just won. No, they had won a union election, and they were negotiating a contract. And we talked to Carla immediately after she won her election, I think. I don't know. It's been so long since we've had those. But those were very good conversations. And in fact, the conversation that we had with Bill and Joe was one of my favorite interviews that I've done. And I'm constantly, even though it was like a year and a half ago, I'm still calling back to it. So those are in the show notes. I recommend giving them a listen.
But good reminder. We need to
have some more nurses on.
Yeah. It's great to talk to people from different industries. We need to get some more healthcare folks on. And I know in terms of healthcare, the most exciting union from my perspective is National Nurses United. It seems like they have a lot of energy and are really moving in a good direction. But that's coming from a total outsider. So. Yeah, take that for what it's worth, but
Jane McAlevey has written a lot about nurses unionizing in her books. I'd recommend reading some of those. Raising Hell and Raising Expectations by Jane McAlevey. No Shortcuts. Good books. Very good books. Support for this program also comes from the Ironworkers Local 477. So if you are looking for contractors with lower than average EMR and TRIR, they tell me that if you need to know what those mean, then you will. Or if you need to supplement a workforce at any level for any amount of time, short or long term, if you need ironworkers that come trained and certified at no extra cost, or if you need workers from superintendent down to general laborer and you're looking to start work on a project, or you're unhappy with your current contractor situation, you need to call my friend Jeb Miles with the Ironworkers Local 477. They only work with the best in the business, vetted contractors, and can do all kinds of jobs from roofing to steel and bridge erection, from welding to heavy rigging, from structural repairs to machinery alignment, and much more. They supply manpower on 4 of the 5 largest projects in North Alabama, so you know they're legit. If you need good quality, safe, efficient, diligent, and knowledgeable workers on your job, then you need the Ironworkers Local 477. Call Jeb Miles at 256-383-3334 or via email at local477@bellsouth.net, and make sure you tell them that you heard about them on the Valley Labor Report.